Good morning. Here's a different view for you. This is from the front of the house. Doc J here. Today we're going to talk about the importance of pregnancy in chiropractic. I am in chiropractic. There could be subspecialties. Naturally, we're all trained in adjusting the spine and the skeletal structure to improve function in the body. But there are subspecialties in chiropractic, and some chiropractors specialize in sports injuries. Some chiropractors specialize in pediatrics. Some chiropractors specialize in back pain specific. Other ones may do just neck. And then you have a subspecialty of obstetrics. Obstetrics, not meaning that we deliver babies, but we offer prenatal care throughout the entire 9 months of pregnancy. And chiropractic is probably one of the most valuable parts of the pregnancy healthcare team. And sadly, not many women know about it. More and more are learning about it, but chiropractic is essential to the pregnant woman. One, again, as in everybody else who goes to the chiropractor, we're removing nerve blockages so that nerve impulses can flow so that the inside of the body functions properly. This is very important for the developing baby because the nerves in the lower back go to the uterus where the baby is. So the developing baby getting those proper nerve impulses is essential. 2, pelvic alignment. Pelvic alignment is the crux of having a baby. You have to make sure that the pelvis is balanced and centered. And that's what chiropractors do. In pregnancy prenatal care, we specifically work on the sacroiliac joints and the ischial joints and the sacrum to make sure everything's centered and that the muscular stability is there so that the woman can go through a labor and delivery that research has shown under chiropractic care is usually shorter and less uncomfortable. And usually with pregnancy, less medications are involved if women have been under chiropractic care. So that's really big. 3 is round ligaments. Round ligaments are the ligaments beneath the abdomen that support the pregnant belly. And when the pelvis goes out of alignment, the round ligaments now become stretched and taut. And that tension in the round ligaments pulls up on the belly and causes a constraint. The constraint means that now there's less space in the abdomen for the baby to move, and that can sometimes prevent the baby from going down in the head down position, turning in the head down position. And that would be a breech baby. And we're not treating breech babies, but what we're treating is the round ligament tension. When we loosen that round ligament tension and correct that pelvic alignment, we restore all that space where the baby can turn head down. Sometimes you'll see me, I'm looking out a little bit because this is a different view. And now I have the street, so it's Sunday morning, so we got a lot of bicyclers going by, joggers are waving at me, so and they're looking at me and they're trying not to goof on me because I'm with the camera. But anyway, uterine constraint is a big issue that we can avoid with chiropractic care. And that technique of working on the round ligament is called Webster's technique, developed by Dr. Larry Webster in the 1970s. And chiropractors that use the Webster's technique have to be certified and trained in that. And I have been certified, trained Webster's technique practitioner for well over 20 years. And I use that technique constantly in our office, as you see all the pregnant women in here, or you may have already been a pregnant woman in my office. So those are the 3 big things, the 3 main reasons why pregnancy chiropractic and prenatal chiropractic care is so important. The other reasons is that with pregnancy during the 9 months also comes typical pregnancy-related aches, pains, and discomforts. So yeah, you're going to get backache from the abdomen, the heavy abdomen, the baby developing, pulling on your lumbar spine. That can cause aches and pains. We help with that. When the pelvic goes out of alignment, it can press on nerves and cause sciatica leg pain. all the way down to the foot, and that's something we help with chiropractic. And then also sometimes with the excess swelling, pregnant women will get carpal tunnel syndrome. We take care of that. And any other types of aches in the beginning, there's been some studies that's shown that chiropractic care has helped with morning sickness, the nauseousness, and it's all related to the vagus nerve in the neck that goes down to the digestive system. Pressure on the vagus nerve can cause nausea, so when we do adjust the spine and the neck, we can help alleviate that. So as you can see, chiropractic care and pregnancy go hand in hand. It's a natural fit. The other major benefit to chiropractic care is that it's a drug-free, all-natural profession. Pregnancy is probably the only time in a person's life where they're told to be drug-free and all-natural. So if you have aches and pains and you go to your obstetrician, he can't prescribe drugs and medications, so there's really nothing they can do. So then again, the ball falls firmly in the chiropractor's court, because we are drug-free and we help take care of your body naturally just by realigning everything and taking pressure off the nerves. Now, once the pregnant woman has the baby and pregnancy ends, the next thing that happens is you'll have a baby that's going to be feeding. And you know, predominantly the largest percentage of women are breastfeeding their babies, and now the aches and pains tend to leave the lower back and they move into the shoulder area from holding the baby like this, and your shoulders are all crunched and over. So then chiropractic now becomes a natural for helping the aches and tensions and discomforts from feeding the baby, carrying those baby carriages, and just all around lugging everything around with the baby bags. Now, since I'm on the note of babies, the next most important thing is you should have your infant checked for subluxation, misalignment of the cervical spine. Well, why would you do that? You might ask. I'm going to bring my newborn baby to the chiropractor. Well, the birth process is itself, when the baby is being born, the doctor is actually, I'll use the word guiding, but the doctor is pulling on the baby's head, and almost every single instance of this, the baby's head is turned. And when the baby's head is turned and the doctor is pulling on it, that is exerting a force at the atlas occipital area beneath the skull, and that's creating tension there, and it's causing a misalignment. And those children who have that misalignment are the ones, and the bigger the misalignment, those are the ones that are going to have difficulties breastfeeding, because it's going to hurt their neck when they turn their neck to feed, and maybe they won't turn to one side or to one breast. Those children are the children that end up having the colic and the croup because of the nervous system imbalances. And then as they get older, those children could be the ones that develop the ear infections. So it's vitally important to include chiropractic care as part of the pediatric care, the well visits for your child. All right, so if you have any questions on chiropractic and pregnancy, chiropractic and pediatrics, of which I have been adjusting infants and babies and children for 33 years, so I definitely am experienced in that. If you have any questions, feel free to ask, and I'd be more than happy to spend time talking to you about it. All right, so let's have a great day, and I'll be in the office to see you shortly. So here I am back again, so I figured let me show you the front yard. We don't get to ever see the front yard too much. All right, so this is the stairway up to my door there, and this is the little garden we have in front of the front porch with our rocking chairs, and then our summer blues flag. Yeah, I'm a big flag guy, right? So here's the front garden, and we like this one a lot because these babies just are so cool looking all summer long. They grow and grow, and the biggest problem is they just keep spreading, and they've overfilled this whole garden. So I don't know what's going to happen next. Are they going to start coming out into my lawn. And the question is, do I replace my lawn with those plants, huh? And that is the front of our house there. Okay. And there you go. All right, you guys have a good day.